There's no doubt that a healthy population is required to provide the necessary human capital to spur the needed macroeconomic development. The World Health Report of 2010 defines universal health coverage as a target in which all people have access to health services and do not suffer financial hardship paying for them. Evidence abounds on the impact of universal health coverage schemes on increasing access, increasing financial risk protection, and improving the health status of various populations. The two components of access that must be addressed to achieve this universal health coverage are physical and financial access. The 2012 United Nations General Assembly recognized that improving social protection towards universal health coverage is an investment in people that empowers them to adjust to changes in the economy and the labor market and help support a transition to a more sustainable, inclusive, and equitable economy. It's where Nigeria ought to be. So, as you are aware, the National Health Bill has just been passed by the Senate, and hopefully the Federal House of Representatives will also concurrently pass it. That will improve access, even financial access for Nigerians as well as healthcare. But what we are going to do, what the President is going to do with this summit, outstrips even some of the provisions you have in the National Health Bill. Is going to be much more comprehensive. It's going to address also not just financial access but geographical access, because it's also possible that you may have health insurance scheme and you happen to visit a particular part of Nigeria. You suddenly fall ill and you can't find even a health facility to go to. So the idea is that this has to address everything, not just the financial access, which is very important because most people are being held back by financial access, but importantly also geographical access. And then we also want to insist that there has to be standards that we must enforce, standard at all levels of care, which we have not really properly articulated so far in this country. There have been snipers of efforts here and there, but we've not fully articulated it. We are going to address issues of referral. Right now, there's no clear-cut referral system. People just visit the nearest hospital to them. It shouldn't be that way. When you have a problem, the first person you visit should be predictable. You should know where you should go and secure your primary care. And if there's then need, then the care provider will then send you to other levels if it's really necessary.
Good morning, sir.
Whether you patronize public or private hospital, whether you patronize federal government-owned or state government-owned hospital, anything called healthcare, that's what we're addressing.
More questions, please.
That's a lady there.
Yes.
To set aside all VAT deducted from.
So, and you people know that if it were easy to convince people about good things, then certain people who have lost their job by now, the clergy who have lost their job, but every Friday and every Sunday, people still go there, even people who are 60 years and over. We've had this message several times over. Why is it that we're not doing what we have been told all these years? It's not easy. So it's because of that we are having, and because sometimes too the media and the ordinary Nigerian doesn't understand it. They start asking the president or the minister, how come we are not covered? It's up to you. That's what the law said. If you walk up to the ES, he's here. After this brief, if you follow him, he will take you in a trailer to his office and they will get all of you registered. That is what it is. But we know that it's not in our interest to leave it this way. If we have ensured that even ordinary vehicles, that is mandatory, compulsory, even when you buy a motorcycle, to have it insured, I think we should just go all out and he sees that human life, the Nigerian life, is so precious that we're making it compulsory. It's no more something that whether I like or not. So, but we have an amendment bill which is before the National Assembly. Maybe that's where Rabi was coming through. It's still before the National Assembly, and I think they've held the public hearing on it already. Yes, because we participated. That was to help strengthen. It's still nothing like what the president now is proposing, but that was to strengthen what we already have. To now amend that law, for instance, to say that all employers of labor at a certain level must ensure that they buy health insurance for their employees, which will be still better than what we have today, because what we have today makes it voluntary. But that one is now saying all employers of labor is now mandatory. So, you know, just to give you an idea of what is before the National Assembly at this moment. What was the last part of your question?
Money. Whether you can use VAT.
That, well, let me be honest with you. We can do a lot better with funding, and I believe that's why the president is hosting this Universal Health Summit, the Presidential Summit on Universal Health Coverage, to explore so many ways that this can be funded in a sustainable manner. But let me be honest with you. It's difficult to compare countries because of current priorities. I don't know whether you're getting the point I'm making. Each country at any particular point in time will have certain priorities that is occupying the people. Health is always standard priority. Any day it will always remain priority, but in terms of position it can vary. I'm sure you know during the Civil War, I'm sure you know government at that time were just more interested in prosecuting the war. So there are challenges that come to countries, be it electricity power, be it security challenges, whatever. Those tend to also influence the order of priorities in every given country. But certainly, what has been happening is that even indirectly through VAT, over the years, health has also been funded. As you know, generally health commodities do not attract VAT. I hope you know when you import or you sell, you know, drugs and equipment and the like, they don't attract VAT. So in a way, indirectly, that is also funding health. And even now, if you are importing equipment and you are going to use it to establish a hospital, a health facility, not to resell, there's no import duty. But let the ES of National Health Insurance take.
When it comes to source of funding, as you heard now, workers are also expected to contribute. That's what we are still looking at to complement what federal government is. 1.75% so that they can be covered in retirement. And Nigerian workers should take, use this opportunity. Now that we have this source of funding will dry up by next year for maternal and child health, will support. But these are employers of labor. They are individuals who can pay just 15,000 naira per post, and to see how it can include the fact where people in diaspora are people who are well. The formal sector consists of about 70% of school children in primary schools nationwide, another 5 children in 2015, so that we can achieve. Our plan is able to surpass it by 10%. Or who help us to damage our health to send the pipeline for 2015. Thank you very much.
Can we have more questions for this asset? To some rural areas, you find it very established. Why don't they go to the rural area? Because they are afraid.
So what the federal government is doing is to, as a kind of a top-down measure, because ultimately, states and local government have to own and run primary care. We need to just provide the policy direction, prevention, stewardship, and also to set to monitor the path implementation. So, working with the state and local governments, we've conceived what is known as primary care under one roof. The primary care under one roof is a total package that speaks to the issue of coordination at the state level, provision of human resource at that level, and then also ensuring that we have primary care center in every ward in this country. We have slightly lower than 10,000 wards in Nigeria. And if you look at the total number of primary care centers we have in Nigeria, about 22,000 populated provinces. And some wards have 3-4 primary care centers, some none. So the issue of equity is also there. So this bill, this summit will address those issues in such a way that in every particular ward in this country, there must be a primary care center. And when I say primary care center, I mean a functional primary care center. Functional in terms of the quality of care, functional in terms of human resource for health, and then communities. Because one reason why Nigerians have lost confidence over time in primary care delivery is because even the primary care center is there. There are no human resources to run this primary care center. And even the human resources are there, they may not be commodities. So that has over the years eroded confidence of Nigerian primary care delivery. We want to bring back that confidence, and I'm optimistic that by the time we're done with this summit, the issue of equity, the issue of physical access, the issue of quality of care will all be addressed. This is a new way, and I'm sure at the end of this summit, Nigerians will be smiling and very happy that Mr. President has turned around the health system. Thank you very much.
Thank you, Edie. And of course, those of you who have been closed down, the workers will lose their.
No, I don't know how our people will be lectured or spar what and what that is good for their body and what and what that is not good for them. Because you see mothers, before their kids go to school, they go to one bobo or something like that. But they don't know it's garbage they're giving them to put in their body. So this give me concern. The Honourable Minister, please, if there's a way the advocates can help us to lecture people on some of these things in order to help us so that we'll be free from sickness.
Take a stand on the so-called energy drinks. Caffeine occurs naturally in many of the things our people, some of us even abuse cola nut. So there are many things to look at. So apart from regulating products such as these energy drinks, I also agree with you that there's also need for a lot of health education, because NAFDAC may regulate energy drinks. How they will regulate cola nut, I don't know. It may even cause a problem for us, because some people just keep chewing it and they will say, no, you see, but I agree with you, we need to continue to educate our people on what is right for them and what is wrong. So thank you for that.
Thank you very much, the Honourable Minister.
The Honourable Minister.
Immediately we leave this project. Having said that, I want to call on the Permanent Secretary for the Administration of Health, Ambassador Salim S. Bala.